How do pulse sequences enhance lung cancer MRI scans? Imagine trying to see tiny details inside the lungs, which are filled with air and constantly moving. MRI scans can be tricky here because the lungs have low proton density and are affected by breathing and heartbeat. That's where pulse sequences come into play. They are specific patterns of radiofrequency pulses and magnetic field gradients that tell the MRI machine how to gather signals from tissues. By using advanced pulse sequences, doctors can get clearer, more detailed images of lung tissue, even in the challenging environment of the chest. One of the biggest improvements comes from ultrashort echo time and zero echo time sequences. These are designed to minimize the delay between the initial radiofrequency pulse and the signal measurement. This quick timing allows the MRI to better visualize lung tissue, which normally shows rapid signal decay. These sequences help detect small lung nodules that might be missed on traditional MRI scans. They also enable free breathing imaging, meaning patients don't have to hold their breath during the scan, making the process more comfortable and reducing motion artifacts. This is especially useful for patients who find breath-holding difficult. Another key role of pulse sequences is in characterizing lung lesions. Diffusion-weighted imaging is a special pulse sequence that measures how water molecules move within tissue. Malignant tumors tend to have higher cellular density, restricting water movement, which DWI can detect. This helps differentiate benign from malignant nodules with a sensitivity and specificity around 80%. Dynamic contrast-enhanced sequences are also used, where contrast agents are injected and their uptake and washout are tracked over time. This provides insight into the blood supply and biological activity of the tumor, helping doctors decide if a nodule is more likely to be cancerous. Pulse sequences also improve staging by providing detailed images of how the tumor interacts with nearby structures. T1-weighted and T2-weighted sequences, especially when combined with fat suppression techniques, help clearly define tumor margins and invasion into tissues like the chest wall or mediastinum. Sequences such as short tau inversion recovery and diffusion-weighted imaging are useful for identifying metastatic lymph nodes, which is crucial for accurate end staging. Respiratory and cardiac motion can make lung MRI challenging, but advanced pulse sequences combined with techniques like parallel imaging and compressed sensing speed up the process. These methods allow for faster image acquisition, often enabling scans to be done while the patient breathes normally. This not only improves image quality but also makes the experience less stressful for patients, which is vital for follow-up scans and screening. Some pulse sequences are designed to measure how lung tissue responds to breathing oxygen. Oxygen-enhanced MRI can assess ventilation and perfusion, providing functional information about lung health. This can be helpful in understanding how well the lungs are functioning alongside detecting tumors. In summary, pulse sequences are essential tools that enhance the capabilities of MRI scans for lung cancer. They improve the detection of small nodules, help distinguish benign from malignant lesions, provide detailed information about tumor extent, and make scans faster and more comfortable. These advances make MRI a valuable complement to other imaging tests like CORT and PET scans, helping doctors diagnose, stage, and monitor lung cancer more effectively. Always remember to consult healthcare professionals for personalized advice and interpretation of imaging results.